Hi, I'm Dr. Jan Taplin. Welcome. I am here today with Joey Larson, who is a doula, and Erika Urban, who is a midwife. Joey is the owner of Birthing Miracles, and Erika is the owner of Urban Birth Midwifery Services. And why don't you share a little bit about how you got into being a doula and a little bit about yourself?
Well, I became a doula because my mom was a doula before the word was even really popular. She used to work with teenage girls,
Okay.
and I was around birth all the time, ever since I've been about 5. So I wanted to become a doula all my life, but there were things that kind of stopped. I had a special needs child that needed my attention, and I had a 19-year-old now who needed my attention, so I kind of waited till they were accomplished what they needed to do, and then I began my journey.
Great.
Well, I got into midwifery really through, I had my first child who was a planned hospital birth, and I really honestly thought that the idea of hiring a midwife sounded bizarre and a little bit crazy. And after having a fairly complicated first birth, we decided to go a completely different route the second time around, and we hired a midwife. And once I got a chance to see what she did for her job, I decided that is what I wanted to do. And so I started my studies at that point and went forward.
Great. I would assume that a lot of people know what a midwife is. Maybe not so many people know what a doula is. So can you guys share the differences?
Yeah, a doula really is there for the family or the mother. She's a labor assistant. She does nothing medically. She does a lot of labor support emotionally, and she's just there to make sure that their birth plan's met and that they have enough stability throughout their birth to accomplish what their birth plan's for. So she's really there to help the mom and the other partner, if possible, to become the best they can at natural birth, if that's their option. If not, just to be there to make sure that she's the advocate for them so that they can have a voice throughout too as well of what they're looking for during their birth.
Okay. Now you use the word birth plan. Can you just share a little bit about that, and then I'll have you talk about what midwife is?
A birth plan is kind of what they lay out how they want their birth to ideally be. They will lay down they'll write down exactly like what they're looking for. They're looking for dim lights, they're looking for no medication. Are they looking for different techniques during labor? Are they looking for being able to eat? Are they looking for a water birth option? Are they looking for different options? And then we kind of lay it out so that the doctor or the nurses or the midwife has an idea of how they want their birth to go, and they can feel more positive about their birth and ready, and everyone knows that they're on the same page.
So they have a plan, but it doesn't necessarily always follow that plan, and you make changes as you go.
Yep, babies never follow a plan exactly, but we always hope for the best.
Great. Okay, Erika.
As far as what a midwife?
Yeah.
Yes. So as a midwife, I offer full scope care. So people, if they want to see me, they don't have to see a doctor in addition. They can come to me for all their prenatal needs. I do full prenatal care. I can order labs and all that kind of stuff. Then I provide all the care during a birth. So I am with the family. I do all the monitoring. I do a lot of coaching, whatever the family needs. And then I also offer full scope postpartum care. So I give a full 6 weeks of postpartum care to families. And a lot of that involves breastfeeding assistance, making sure that the mom is healing up well, that she's getting enough rest, kind of giving guidelines to the family as to what that rest time should look like to make sure that moms actually take advantage and are in bed, just getting to know their babies and recovering.
Okay. So Joey, do you do follow-up care?
I do. I do 2 follow-up visits afterwards just to make sure. I look more at the aspect of, do they have meals provided? Is their family involved? Are there any questions that we need to get them some other care? Do we need to get a lactation consultant in? Do we need to get some other things in and make sure that the family is just ready to go as a unit, functioning emotionally, and if they have any questions on parenting or so forth. So I do follow up twice afterwards.
Okay. Now, a lot of ladies like to have ultrasounds. Do you provide that, and or do you recommend maybe something different?
Yeah, so if somebody needs an ultrasound, that is something that I can order for them. I don't do them myself. I just order it out. Now, in my practice, I would say that a good probably half or more women choose not to have any sort of ultrasound during pregnancy, and I always tell people that if there is a reason that we need to take a closer look, I will absolutely let them know that, but otherwise I don't require 20-week anatomy scans or anything like that. It's more, if there was a concern about baby's growth, if we were starting to suspect that there might be twins or more, those sorts of reasons, unexplained bleeding, something that we decided we need to investigate further, then I would recommend an ultrasound, and otherwise it's completely parental choice.
Great. Can you share a little bit about your education and training?
Yes, so I'm a certified professional midwife, and then I'm also licensed in the state of Minnesota. Now the certified professional midwife, it's different from a certified nurse midwife who gets a degree in nursing first and then goes on for a master's degree in midwifery. A certified professional midwife is a direct entry midwife, so I went directly into midwifery training. It took about 3 years, and that tends to be the average, is 3 to 5 years to become a CPM. And I did a distance learning program and then did an apprenticeship with 2 licensed midwives, as well as some stints at a high volume birth center to get all my training. So
Great. And Joey?
I did mine also on a distance learning with birth arts, and I became a doula last year. And that took extensive reading, working with having so many births, and then I am also have a license number now that I can use for insurance purposes.
Okay. And speaking of insurance, can you touch on that a little bit?
It depends on what insurance you have. Blue Shield Blue Cross is usually one that I've seen that's been very good at reimbursing, but you have to contact your insurance first. You have to see if they're willing to do any reimbursement for doula services, and if so, then we can go forward. And then usually what happens is they pay up front, and then they send in a submission to get reimbursed.
So if someone were going to pay and they didn't have insurance coverage, what are your fees?
My fees vary. What I usually look for is $600 a birth. That includes meeting with them, doing the birth plan, and then 2 visits afterwards, and also, of course, the birth and whatever else they need in that time. But if I have a family that is really needing a doula and just doesn't have the finances, I'm not going to let that stop me. I really feel this is something God has called me to do. And so if I have that opportunity to work with them, and I really feel, then I will work with them on a sliding fee scale basis.
Thanks. And how about you, Erika?
So the way that insurance works for me, and again, it's very similar, where I have people pay upfront because I would be out of network for anybody's insurance company. I actually do the insurance billing myself. Usually the reimbursements will go to the family, and it really depends on the insurance company. At this point, medical assistants in Minnesota Care do not cover home birth with the midwife. They do cover birth center care with the midwife, and so if that's something that people want, then I direct them to the lovely facilities that we have in the Twin Cities that are options. And so my fee without insurance is $3,200, and that covers the prenatal care, the birth, and the postpartum care. It covers use of a birth pool, an assistant, kind of everything that they would need, as many appointments as they need. And much like Joey, if there is a family that cannot afford that, I've worked out a lot of arrangements with people. I've bartered.
Wonderful.
It's kind of fun. I've gotten watermelons and a quarter beef and bread and homemade jelly, and
Wonderful.
so it's actually it's kind of like Christmas then. I get to bring home little gifts. So
nice. Could you share maybe a typical experience?
Sure. Well, a great experience would be that everything goes to plan, that, somebody has a really uncomplicated, kind of boring pregnancy. I like boring. And then a nice, easy, what I call a butter birth, when everything just goes so easily and so smoothly. So pretty typical for that would just be a labor that unfolds in a pretty textbook manner, where somebody knows that they're in labor, it gradually builds up, they're able to just birth. I always love to watch families catch their own babies, and so that's a big bonus in my book.
Okay.
And an easy postpartum time, you know, again, no complications. If they can just rest in bed and nurse the baby and have no worries, that's always lovely. You know, and at times things don't go to plan, and in those situations, while it's hard on everybody, we do transport into the hospital. In my practice, we have approximately about a 12% transport rate. So, of course, that means 88% of the births that are planned at home are happening at home. But about 12% of the time, I've needed to take women into the hospital for more assistance. Now, a lot of times when people hear that, they're picturing an ambulance and an emergency. Most of the time, what it is a really prolonged labor. With just not enough progress, the mom is getting exhausted. We want to head in before we run into problems.
Yeah,
you know, especially if her waters have been broken for a long time or any sort of situation like that. You know, and that can just be hard on everyone. And of course, you know, several of those women may end up getting C-sections as well. And so when your birth goes kind of the opposite of what you were planning, that can be really difficult emotionally, but I stay with the family the entire time so that I can hopefully help them process those feelings, and they still get the same postpartum care that they would have gotten had they birthed at home. So we try to make it as much like the birth that they had planned as possible.
So will you step in and say to the doctors, this is what the mom was wanting, and can we please do this versus this if at all possible?
Actually, what I find is that most of my clients are quite empowered and very ready to speak for themselves. They know that I'm right there holding their hand. I'm there to explain anything that they feel confused about or need more information on. But across the board, when I've transported people in, they've been pretty proactive about speaking up to the doctors about what it is that they want or don't want, or asking questions if they don't understand.
Nice. And how about you? Share a couple experiences.
I have two. Well, if you're going to have a hospital birth, the best thing is to be just easy, you know, monitored as less as possible if they let you. No complications, natural birth, no medications. Then there's the home birth that is with a midwife, and that is just a different experience. It's very peaceful, very letting the mom empower her own body to give birth, which we were created for. And those are like the best. There's nothing better. And also to see a family catch a baby is amazing. And to have the postpartum go well, have people usually lined up with meals and everything's just ready to go, and you just walk in and go great and hold the baby and you know, everything's wonderful. And then I've had one where I've actually been with a family, and the dad did not want to go into the C-section room, and I had to go. And so that was my very first birth ever that I doulaed for, and I actually had to go into the C-section room with the mom. And that was, for me, a very huge process, but it was also a really great process because now I can inform any client that would have to have that option of exactly what is going to happen step by step. So it has, I think, helped me become a better doula in that way.